Hello, and welcome to the third session of the Iowa Public Health Leadership Academy. To those of you with us for session 1 and 2, thank you for joining us again this evening. And for those of you that are new to the Academy, we want to welcome you and thank you for taking time to participate in the Academy. My name is Lori Wachner, and I'm the Interim Director of the Institute for Public Health Practice at the University of Iowa College of Public Health. This Academy is offered in partnership with the Iowa Department of Public Health. This is the third of 6 sessions, and tonight's session we're going to cover public health law in Iowa. We'll have 2 primary presenters discussing various topics, and we'll also hear from local perspectives from 2 additional public health professionals regarding specific issues they've dealt with in the past. These sessions are designed to build on content from previous sessions, so if you missed the first or second session, you can view it by accessing the Iowa Public Health Leadership Academy website at iowapphla.com. As a reminder, we'll continue to meet every 7th Monday to go deeper into Iowa's public health system, with our next session taking place on April 13th, and that session will focus on health equity. Before I turn it over to today's speakers, I just have a few comments about the session. All participants are muted on today's webinar. However, during the session and subsequent sessions, we built in time for questions and answers throughout the session to help facilitate meaningful discussions and also clarify any content that's been presented. And this actually came from a suggestion from past evaluations. But we encourage all of you to ask questions. You can type your questions into the chat box, which you'll see either by going to the top of your screen or bottom of your screen, and there'll be a chat box to type those in. If you experience any technical difficulties throughout the call, please use the chat box feature for this support, and you can send your message to Hannah Schultz, and that will prevent it from going out to the whole group. We're recording today's webinar, and we'll make this presentation available to everyone who's enrolled in the Academy via our website, and we'll send it out with a follow-up email. In addition to questions and answer portions of the webinar, we'll also make available those questions and answers, but we'll take out the identity of the person posing the question or any relationship to their communities. This protects the privacy of individuals participating in educational offerings and is in accordance with the Family Education Rights and Privacy Act. An evaluation will be sent to you after this session, and evaluation data again will be used to help inform us of our next webinar and to make improvements. And we really want to thank you for all the feedback that you've provided and the future feedback. One last announcement before I hand things over is that the Iowa Public Health Association is offering a 1-day workshop entitled Dare to Lead on April the 6th in Des Moines. This workshop is based on the research of Dr. Brene Brown. Dare to Lead is an empirical-based courage-building program, which is based on 4 courage to lead skills: grumbling with vulnerability, living into our values, creating trust, and learning to rise. The workshop will be led by Dr. Rosie Ward, who is trained by Brene Brown as a certified Dare to Lead facilitator. The workshop actually occurs the day before the 2020 Iowa Governor's Conference on Public Health. So a link to the workshop is already posted and ready to go if you want to go there and register for the workshop. So this is the workshop, and now we can focus on content for today. All right, so now we'll focus on today's content, and we hope that today we'll provide you enough information regarding laws, regulations, and guidelines related to public health in Iowa and what your role is in carrying these out. The learning objectives, as you can see on the screen, further will define what you'll gain from this session, and the competencies are really a reflection of the skills that are desirable for individuals who engage in public health practice and management. The competencies provide a framework for workforce development to better improve the roles and responsibilities we play in enhancing the health of our communities. So with that, at this point, I'd like to turn the program over to our primary speakers, Mike Bennett, Assistant Iowa Attorney General, and Denise Hill, Associate Professor from Drake University. Mike?
Good evening. I'm Mike Bennett with the Attorney General's office. My principal duties at the office have been to work with the county attorneys of each of your counties and provide them training and support in both their criminal and their civil duties. I train on both areas, although I have tended to do more in the civil work. And so usually if there's a question from your county attorney on some of their duties, such as dealing with the Board of Health, those normally come my way. So we're going to do an overview of some of the governance issues and statutes that arise with the Board of Health. Some of these things are common to other areas as well, of the other boards and commissions at the county level. But we'll try to tailor it as close as we can to the Board of Health duties that you guys have responsibilities for. So when we're talking about county governance, we have to talk about home rule powers. Home rule amendment to the Iowa Constitution, there's actually two of them. These are powers that are granted to cities and counties in order to effectuate the services that they do for their communities. Home rule changes. It used to be that both counties and cities derived all their powers specifically from statutes that gave them very specific powers. So if you ask, could a county or city do something, you'd have to go to the code and you'd have to see if there was a power somewhere in the statute that specifically provided their ability to do so. Home rule kind of shifted that and gave some more broad general powers to both cities and counties and allowed them to innovate within those areas of code. So generally when we're dealing with local affairs, counties and cities have the ability to do what are called the police powers: peace, safety, wealth, health, welfare, comfort, convenience of residents. So the sorts of things that you think of as regulating what happens in the community in a way to, and providing services in a community in order to make it a livable, safe place. So these rules are pretty broad, but there are some limits. They have to be solely on local affairs. They can't pass things that are broader than their jurisdiction area. Taxation is something that the state has kept within its jurisdiction totally. So there's no way, you cannot levy a tax without actually having the legislature pass authority to collect that tax. So there's any local taxing that happens has to be under a statute where like some local option taxes, things of that nature. You can set higher standards than state law in the areas of the police powers, unless there's a provision in the code that says you can't. And if a county action conflicts with a city action, the city action will prevail within the city limits. Finally, it has to be consistent with state law. So if there's a state law that covers the same area, it needs to be consistent unless by its terms or its context it allows for local for some local variation. We have a fairly new one that somewhat applies to boards of health, and that is they added to the statutory home rule limitations that local governments cannot regulate the sale, marketing of consumer goods, including containers. So there were some other states where we saw in cities that were regulating things like the size of soft drink containers and the use of plastic bags in stores. The legislature took away or made it clear that those are areas that are outside the authority for local government. So generally these powers, these home rule powers, are vested in the County Board of Supervisors. And so generally they will be performed at the direction or control of the Board of Supervisors. except as otherwise provided by law. So what that means is generally, if we're not sure who has the power to do these police powers, it's going to be the Board of Supervisors. We have other county offices, boards, commissions, other elected officers, appointed officers that are also specifically given powers under the statute. And that's kind of what we're talking about tonight, the powers that have been given to the local boards of health through the legislation that covers this area. So the general scope of authority that boards of health have, first of all, there's a state element of it. As you're probably familiar, you're sort of the enforcement arm of the state board and the state laws that affect the health-related areas in your jurisdiction. And then you also have the ability to make or enforce local health rules and regulations if they're not inconsistent with state law. And if they're, so these are things that are intended to improve public health in your area. So you have the ability to innovate somewhat. Again, we have this limitation with these consumer goods that were specifically pulled out of the home rule powers that counties otherwise have. So this is this idea of the local regulation. This is a power that's granted to the health boards, but it's also one in which the Board of Supervisors has a piece as well. And so it's a cooperative effort. You have the ability to set local rules and regulations in the health, within your power area for public health issues, if they're not inconsistent with state law. But the Board of Supervisors have the ability, before you can enforce these local rules and regulations, to grant approval or not grant approval by motion or resolution of the local rules and regulations. So in this case, you're not specifically granted home rule authority. You're limited to the subject area of public health related activities. And the Board of Supervisors can decide whether or not to approve these local regulations before they can go into effect. Procedurally, once you go through that process, these would be published in newspaper after passage, and then they can take effect within your community. Liability. Actually, let's skip over this issue because I don't have a whole lot to say other than what's on the slide. Okay, Board of Health. Here are some of the powers that are specifically granted to the Board of Health. First of all, the ability to employ persons necessary for duty. So as a Board of Health, you get to determine what your staffing needs are, how many folks you need, what you need to put in various areas. You get to determine who you want to hire, what there may be standards that apply from other sources, but from the county law itself, no other board or commission at the local level is going to be setting those determinants for how many folks you need. This is mostly going to be determined by the amount of money that you have available in your budget, so you can staff accordingly with those resources that you have. One of the things that local boards need to do is adopt employment practices that either meet the civil service system or the state merit requirements. It doesn't have to be the exact same system, but it has to have sort of the basic elements of these systems. And basically what these systems do, this is an area of law where it gives some protection to employees that are conducting discretionary sort of regulatory behavior or activities. Basically, we want people who have to enforce laws and rules to not be able to be discharged without good cause. And that is to protect the independence of those positions and make sure that people aren't kept from doing their duties in fear that there might be political ramifications or somebody taking revenge. So you have these protections of civil service or merit in making those sort of employment decisions. When you hire at the Board of Health, there is no requirement for the boards of supervisors to approve those particular hires. Those are decisions that are made within the department itself, as well as the pay and benefits that are set. Again, you always have the constraint of the budget, and that will somewhat limit what you can provide. But there's not a requirement that boards of health comply with any sort of pay schedule that's set for other departments in the county. And we'll probably come back to that in a little bit. As far as collective bargaining is concerned, the workers for the Board of Health would be doing those would be collective bargaining with the Board of Health rather than the supervisors. The Board of Supervisors would generally be the agent that would be negotiating with all the other various employees in the county that are in bargaining. Okay. So what happens when somebody does not follow the rules or regulations or the local ordinances in effect under Chapter 137? There's sort of two different ways that this is done. One is criminal and one is civil. The simple misdemeanor penalties for violations of your local rules is so it's a fine that can be up to $350 and 30 days and up to 30 days in jail. And there's an ability to collect or to issue for each day that someone neglects or fails to comply after notice of a violation. So these things can start to pile up. The other way is a civil penalty, which provides a little bit higher fine since there's no potential jail time, $750 to $1,000, or up to $750 or $1,000 for a repeat. So looking at these, there's sort of different tools. I think the simple misdemeanor route is those are done before magistrates. Those are done before magistrates. They're fairly, that's a fairly fluid system. The courts know how to move those kinds of cases through the system pretty quickly. That's oftentimes a very a fast way to get a quick, to get a matter dealt with quickly in the courts. The actual trials and simple misdemeanors are done under relaxed rules, and so that's a fairly efficient system for doing that. The downside is that a simple misdemeanor as a criminal act, and it has a potential jail, a person would be entitled to appointed counsel if they couldn't afford it themselves. And also you have to prove your case beyond a reasonable doubt, which is the highest standard that we have for proof in a court of law. The civil penalties have to be shown by clear and convincing evidence. It's a little lower standard. And there's, having done some of these infractions before in court, they tend to stay around in the court a little longer than simple misdemeanors. There's more follow-up oftentimes. You can oftentimes ask for more than just the penalty, you can ask for the court to order correction of the whatever the if it's a you know, let's say it's a building that is in a unhealthful condition, you can oftentimes get relief from the court to order up that cleanup, and so you can have, you know, multiple trips back to the court in dealing with that. So a little bit less efficient, maybe a better way sometimes to actually get a where you have like an illegal use of property cleaned up through this process. Okay, so they are, the board is set up to be mostly autonomous, not totally free of any oversight or some controls, but mostly autonomous. You're able to set the agenda of what you want to, what's important in your particular area to put emphasis on. You can determine what staffing you'll need to achieve those goals. You can set salaries using your own standards rather than any, you know, some other departments may be working under a template that's set up by the board of supervisors, but within the budget that you're allotted, you have some freedom to set salaries. The same with the expenditure of monies that you can spend on things that are, you know, proper for the board within the budget. And enforcing the health regulations, you're pretty much autonomous in that. You decide which areas you want to put emphasis on, which areas are less needing of service, and so you have the ability to tailor what you need in your community for what the problems are. The Board of Supervisors' main power over these activities is first, they have to approve your local regulations before they go into effect. So they have to say and do that as well. And secondly, the budget, which is all included. Right? If you don't have resources, you can't conduct many of the duties that you do. So budgeting will have a significant effect on what you're able to do. Generally, why do we have boards and commissions at the local level? I think there are a couple benefits that we see. First of all, you're broadening the input of what's, you know, when we have boards and commissions at the county level and at the city level, we're bringing more people, more input into making decisions. So if you think about if the Board of Supervisors had this as one of the things that they were doing amongst all the other things that they do for the county, you would see that they would, having people with a more tailored duty set here gives them an opportunity to get some expertise in these health areas. And so you get a little bit, you know, you're able to concentrate on just one area instead of trying to do a bunch of different areas. By design, health boards have expertise. So by design, health boards have expertise because you have a physician that's on staff. So you develop expertise in this area. It helps to manage the workload, and you're saving resources. You guys, the board members are volunteers. They're doing services, helping out in ways that you probably, if we didn't have a board, we would need to pay others to do this. So here's just a recap of some of the separation, the different roles that the Board of Health and Supervisors play. Real quickly, one kind of unusual thing at the county level is that boards of supervisors are allowed to to sit on some of these county boards. So that would normally not be allowed under the common law, but it is allowed here. Let's skip forward a little bit and talk about the Warren County case, because I think it illustrates some of the other things that are in the fact sheet or in the slides. This is a case in which the Board of Health voted to raise the salary of the secretary. It was something that they had enough money in their budget to do, and also in the line of the budget for salaries. So this was properly budgeted for. And also there was a second action that was sort of at issue here. The Board of Health had terminated the director of environmental health and hired a new director. The Board of Supervisors in Warren County refused to approve the wage increase granted to the secretary and told the director of environmental health that was fired that he was not fired and that he could keep his position. So here they went to court and fought over, who had the authority to do these actions. Where was the authority lodged between the Board of Health and the Board of Supervisors? Here, the claim was by the Board of Supervisors that the Health Board had adopted the county employment manual and their pay schedule, and had allowed prior boards of supervisors to approve hires. So basically, they said that there was a delegation by the Board of Health of these powers to handle these things to the from the Board of Health to the Board of Supervisors. The court said that generally, if you have an entity that has statutory powers, you cannot delegate those powers if they are legislative and government functions. So these are the powers that are given to granted to a board or commission to make the decisions that are sort of their core policymaking area. And so those things are generally ones making rules, deciding how much you're going to spend on what. Those are the kinds of things that are at the core of fulfilling the duties of the board. You generally cannot delegate those decisions to another entity. You may delegate the right to perform some acts. So that's more the implementation than actually making the policy. Here, the court found that there was no clear delegation by the Board of Health, either to fire the employee or to pay or approve pay increases. If there was, they said it's the sort of power you could not delegate. And they certainly would not find it was one where you just, by not complaining about that, the board of supervisors overseeing those acts in the past, it wouldn't be enough to lose those powers. And finally, that if you did delegate those powers, the Board of Health certainly had the ability to later say, no, we want those powers there, and vote to do that. Okay, so let's talk a little bit. Why would a Board of Health want to use county employment procedures or apparatus? So oftentimes we see where there is friction between the Board of Health and the Board of Supervisors. It's where they're using these powers to do separate employee procedures from other counties. Can you think of why that might be a good thing? Are there any?
A reminder, if you'd like to comment or ask a question, use the chat feature.
Well, let's think about that. I think that generally this is a friction point, I think, that we see often between boards of health and boards of supervisors. You often have people that have a different pay structure than the rest of the county, some of the other county offices. You might have different procedures. You might have, you have this for-cause removal that might not be applicable to other things. And I think that to the greatest extent you can, you should try to, the board should try to maintain something that is as close as you can to what's done in the rest of the county. That will probably cause less problems. But at the same time, some of those, there's a reason why there are those powers, and that is to try to keep this board to be independent and make some very important decisions on healthcare. Well, you know the scope of your authority. They're in some very broad areas that are very important and require a lot of expertise. And that's probably the key here. The employment practices here are aimed at allowing people to do their job without interference. And the different pay grades and things from some other departments, I think, are necessary because we're hiring people that have specialized training and that have skills that are oftentimes very sought after in other by other people who provide health services in the community. So I think my time is up. I should probably end there. Thank you very much for attending. And yes, the next speaker is Steve Anderson. So we'll turn it over there.
Can everyone hear me? I hope.
Yep, you sound great, Steve.
Okay, good. Like he said, I'm Steve Anderson. I work for Hancock County Public Health. I am their environmental health specialist. And some of my duties are administering our private well program, our grants to counties, grants, kind of typical environmental health duties. And I also administer our on-site wastewater program or septic program in accordance with the state regulations. One of the things that we've had come up where our Board of Health had an opportunity to kind of exercise some of their good judgment, I think, was, it's been probably 6-7 years ago, we had a couple of communities who the Iowa DNR sent a notice of violation to them. The DNR went out and did some water testing in a nearby creek and found very, very high levels of E. coli bacteria, which tells them that there is septic waste going through the agricultural farm tiles and into the river. So they got a notice of violation that said they had to rectify this situation. Now, these are small communities. In my county, the one community was Woden, which probably has about 80 homes. And the other community was Goodell, which is a little bit smaller yet, probably around 50 or 60 residences there. So I got a notice of the violation too, and was invited to one of their city council meetings along with the DNR. And they were asking, well, what are our options? What can we do here? And the DNR kind of told us that, they could build a municipal system if that would work. The other option would be for every residence and business in the communities to put in their own individual on-site wastewater systems. Well, both cities did a little research and come up with the idea that they wanted to move forward and try to build municipal systems. The problem that they then realized was this was a slow process. Typical small communities, I'm sure all of you have them in your counties, don't have a lot of money. A municipal septic system is going to cost into the hundreds of thousands of dollars. So the wheels move slow, and they were trying to move forward, looking for grants and talking to the USDA and such for some funding and loans. And they come up with the idea or the question, they says, well, what do we do if while we're working on this, we know it's going to take us several years, maybe 5, 6, 7 years to get this done. What do we do with people who want to sell their property and don't have an adequate septic system now? We have the time of transfer law. So legally, a person cannot sell a property without updating that septic system. Or if someone has issues where maybe a septic tank collapses and they can't, their plumbing isn't functioning. And the problem is, if I go in as my duty and say, well, you have to put in a new septic system. Well, what do we do then if in 2 years the city gets their system done? Does that person have to hook up to it? And then they just spent $10,000, $12,000 for their private system, which is now has to be abandoned. And people were really up in arms about things and didn't know. So I visited with my Board of Health, and I visited with the Iowa DNR, the state wastewater on-site man, and also the people out of our regional office. And what we came up with for a somewhat of a compromise was that the Board of Health, if someone, say for instance, an example would be if someone wanted to sell their property and they did not have an adequate septic system, so they were going to have to update. Well, they allowed that person to sign a waiver which said that we had a set time on it. We usually wrote these that they would expire on July 1st of the following year. And what this waiver said was, if the city of Goodell or Woden gets their municipal system done, you will hook up to it. And if the city doesn't do this, then you are going to have to put in an on-site system like everyone else would that lives out in the country, for example. Well, a year goes by, the city hasn't made too much progress yet. So we would renew those waivers for another year. And the one community, the small community of Woden, their city council really got on the ball with this and really jumped at the opportunity and lined their funding up. And we only had to do this for about 2 years. And then they broke ground on their municipal sewer system. And now all their residents are hooked up to a city municipal sewer system, just like a bigger community would have. And everything is good. All the waivers that we wrote are now null and void because they hooked up to their municipal system. Now, the city of Goodell was a little different. They had a change in government, a new mayor, some new council members. And the new council members were kind of content on dragging their feet, or the new mayor, it seems like, and this process kind of ground to a halt. Well, at that point, that's where the Board of Health really kind of came to the rescue there, because their mayor had to come to our board meeting every year and explain progress before we would renew those waivers. And there was some pretty good discussions went on that the Board of Health, pretty much said that you've got to be making some progress here, or, people are going to have to install on-site septic systems. Well, the citizens that were going to have to do that weren't happy. So then they kind of put pressure on the city government, and it's looking now like this whole thing is going to come together. And even the city of Goodell, they've got land purchased now, and they are going to be breaking ground or getting it engineering costs and bids let out this spring, and hopefully be breaking ground late summer next year. And we'll be taking 40 systems that are currently dumping into I believe that's the Iowa River eventually. And they will be now going through a municipal sewer system. And the DNR gave us their blessing. They said, yeah, we could do this as long as they're making progress. We don't want this to go on for 20 years. And it hasn't, so I guess that's kind of our story up there. If you have any questions, I'll try to answer them, or you could send me an email with a question later on. If something comes up, I would be happy to answer. Like I said, I'm in Hancock County.
Thank you very much, Steve. I appreciate you giving kind of that overview of those residential waivers. I know there are many rural counties and rural towns out there that other boards of health may experience that type of thing if they haven't already. So
Yep.
I really appreciate the example.
Okay, you're welcome. Thank you.
Thanks. So we did have a question.
Okay.
And actually this question is for Mike. So Steve, you're good. The question was, so we pretty much are saying we are strictly an advisory board with little authority. And with boards of health, so you still have that authority. You have the authority over deciding what happens with those tax allocations. You get to go through the whole process of determining whether or not you're going to hire staff and have a county health department, or if you're going to contract with another outside entity. Many times that's a health system-based agency or a hospital. And so those are the options that you have. In those instances, when that happens and you do contract with a local public health agency, you are in advisory capacity in that you don't oversee the personnel aspects, the policies, those types of things for those agencies, but you still have all the authorities that have been given to a board of health for all the other pieces. So we don't want to say that you're just advisory in that capacity. It's only in the operations of a recognized local public health agency or who you're contracting with that you would be in more of that advisory capacity overall. And so if you still have a question on that, please let us know and we can answer for you. So next up, we have Denise Hill. Denise is an attorney who also is an associate professor at Drake University. I'm going to let her talk a little bit more about herself, but she's also going to talk to us about the public health kind of law toolbox, how we enforce and can regulate some of the laws that we have out there, and then just a few other things that we felt that you'd want to know more about.
Terrific. Hey, everybody. Thank you so much for taking the time this afternoon or evening now to listen about public health law, and thank you to Mike and Steve so far for providing those perspectives that really set up nicely for what I'm going to talk about. So I wanted to note very quickly that, as you probably noted when you signed up for this, our presentation is designed to familiarize you with the applicable laws, regulations, policies, and procedures and issues that you're going to be running into that have a nexus with the legal world. That being said, we have very little time, and we also have some things that we really want to have you focus on with local perspectives. And so that being said, I'm really going to hit things at kind of a high level. But we also have posted a series of resources that can go into as much detail as you could possibly want. And so I'd really encourage you to take a look at those when you have some time. And my goal will be to kind of help you make sense of it all. Some of the things we've already heard about tonight will kind of maybe fit together well with what we're going to talk about momentarily. So today we're going to cover what I would call the big questions, and these relate specifically back to the objectives that you have. So what's the connection between health and the law? Why are we taking the time today to do this? What's the source of authority for the key legal tools that you use as Board of Health and other people working in this area? What are the tools in the public health law toolbox? And how do we use those tools to try to impact individual and population health? And so we're going to, again, have some local perspectives that I think are probably the most valuable things. So I want to make sure we have time for those, and I'm going to carve that out for sure. So those are the big questions. And so after this section, we're hoping you'll be able to describe that connection, identify those sources, list the primary tools, explain how to use them, and again, improve individual and population health. But how are we going to do that? It seems quite overwhelming. Some of you maybe are new to HELPA. Many of you may have heard these over and over, or maybe even heard me talk before. But how do we make sense out of this, and what some might call chaos of the law? And so it's the law. The law is what makes organized life possible. we didn't have legal aspects of population health, frankly, we wouldn't have population health. And so it helps us to organize what we need to do to make those differences in impacting population and individual health. So what's the connection between health and law? Well, I want to take you back. When I first started teaching about public health law, it was when this was a fairly new slide, which is now 20 years plus ago. But we had at the end of the last millennium, the 10 great public health achievements. And these are the top things that we believe have improved population and individual health: vaccination, motor vehicle safety, a decrease in tobacco, increase in fluoridation of water, et cetera. And if you look at this list, nearly everything that is listed here has some kind of nexus to a law, a regulation, or an action by a body like the Board of Health or Congress or some other group. For example, Board of Health is responsible to enforce the law in Iowa that says that to go to daycare or kindergarten, you have to have certain vaccinations. And that is then carried out through the local Board of Health. And we can look at any of these and find that to be the case. So this is what we call public health law. And again, it's a relatively new term, but it's been here for as long as we've had public health. The legal powers and duties of the state, and the state here means government, to assure the conditions for people to be healthy, so identify, prevent, ameliorate risk to health in the population, and the limitations on the power of the state to constrain the autonomy, privacy, liberty, or other legally protected interests of individuals that, again, we're trying to protect the community health, but we at some point have to balance those interests upon how that impacts the rights of individuals. And so for that reason, we always want to ask, either if we're a regulator or we're being regulated, we're the individual, what is the source of authority? Because for the government to ask, or a government body or Board of Health to act, we have to have authority. And so this all comes from the federal and state constitution. The Constitution does several things. One is it sets out the legislative power that makes the law, Congress and our state legislature, and at a certain point, the state then gives that home rule to you as a county or city to actually then pass ordinances. We have the executive branch, like the governor, the president, the director of the Board of Health, and then we have the court system, the judicial system. All of this is set out in the Constitution, and all authority for the law flows from that. It also sets out between the federal government and the state government, who then can pass it again on to the local government, who does what. And again, then it provides protections for individuals that the government can only go so far when we're trying to, even if it's in the public's interest, at a certain point it may go too far. So these are the key sources of law that we have. And just momentarily, I just want to note that we start out always with the Constitution. Some would say it's the preamble where we talk about promoting the general welfare. Others would say that that authority arises primarily from the police powers that Mike nicely talked about for us before. The federal government has some key things that they expressly are allowed to do, and the rest is left to the state, and the state through its those it delegates to. So the state, through their police powers, is responsible. They have duties to make sure that they are looking out for the population's health. So we have those individual limits then. So the government's authority over individuals at a certain point may go too far. We have what's called due process, which again Mike talked about nicely, that we have people have a right to when they're being directly impacted, or their not only their liberty but their property interests are in play, that we then have to give them an opportunity to be heard and give them notice so that they can make their case for why the government shouldn't take that specific action. They have a right, if they're maybe going to lose their license, to make the case for why the action that's being taken is not appropriate, and so forth. So the high end of the due process scales, we have to have written notice, access to attorneys, a hearing before an impartial decision maker, a written decision, and the right to appeal. The low end just means that we have to make decisions based on information. They can't be arbitrary and capricious. They have to be based on information, and that we have to, again, have that authority in the law. So the state authority for public health comes from Iowa Code 137.5, which Mike has familiarized you with already. And again, it gives you the Board of Health in the county the ability to enforce health laws, rules, and orders, to make and enforce reasonable rules and regulations. Those, again, can be your ordinances or rules. Employ people, all the things that we just heard about for the Department of Public Health and then for local boards of health. So I call it a toolbox because I think sometimes the law is seen as being scary or being something uncomfortable. And I think it's a toolbox. It's a toolbox that we can use to effectuate the public health and to protect the interests of individuals. So we've got the statutory law, which we've talked about quite a bit. We've got the administrative rules or regulations, and those within organizations then become policies and procedures. Those aren't legal documents, but they help us to carry out day to day what those rules and requirements are. Then we have what's called the power of the purse string. Power of the purse strings is he who, well, let's get to that in a moment here. So first we have the statutory law. Again, you can take a closer look at this later, Iowa Code 137.5. Basically, legislation or ordinances require or prohibit action, okay? Or raise money, or set conditions on spending money. And if you think about any of the things your Board of Health does, they will fit within those categories. Then we have the agencies. Board of Health is one of them. I've listed some of the federal ones. Most of them are regulatory. However, you hear a lot about the CDC, and the CDC doesn't adopt regulations or rules. It's more like the question came in earlier about advisory. It's really more advisory in nature. So it's information. So there certainly are public health entities and agencies that are not regulatory. So I mentioned the power of the purse strings. Under the Constitution, the federal government in particular, but the state as well, they can set conditions on spending and they can raise taxes. So this is what we call the power of the purse strings. Whoever has the gold, as they were, makes the rules. And so the federal government will say, state of Iowa or local county, we're going to give you emergency preparedness dollars, but you have to spend it this specific way. Okay? Or we're going to take away federal traffic safety laws if you don't have a motorcycle helmet law. So that's called the power of the purse string. We're using our express power to tax and spend to impact those areas. Then we have case law. There's a host, if you guys wanted to go out and watch the movies here in Brockovich, whole host of different movies where the judicial branch is used to impact the law. Now I would note there's a list of some of the areas that we get into, and even earlier when Mike was presenting, he talked about how the law got into trying to determine who had the authority, the Board of Health or the Board of Supervisors. And as Aaron just pointed out, the Board of Health ultimately, the court said, had that authority. They had that constitutional authority, or statutory authority rather, to carry out those duties of the board, and the Board of Supervisors was not able to interfere in that. We also have a very important function I think a lot of people forget about, and that's education and advocacy. I consider this a legal tool because often that is the best way to get a good legal outcome. It can be mandatory. If you're a physician or physical therapist, you have to take a certain number of CLEs. Most practitioners now have to take mandatory abuse training, so it may be specifically mandatory education. It may be formal or informal, or it could be more preventative in nature. And I've given you some examples here, and on the next page, a boil water order, for example, would be one. We can't go in and enforce that everybody has to boil their water before they drink it, but we will educate them that this is really important. And the board doesn't just do that, they have a process they use to put out a boil water order, so it's legal and function. And then again, we do a lot of educating just about public health in general. So then we have licensure. A lot of this is done at the state level as part of the police power, so being able to practice as a physician, being able to do other things. It's important, though, that we think of this in terms of tools, sort of like the building permit. You're allowed to do this, but only under certain conditions. The same is true for restaurants that the local Board of Health often allows, or hotels. And so for time reasons, I'm going to go ahead and let you guys read these. Then we have the tools that are enforcement. Enforcement is the goal is to have compliance with public health and safety laws. We often use informal approaches, which can be equally important, but sometimes we have to take, as it were, the gloves off. We have to have that, the teeth behind the law to make sure it happens. So again, often we can use an informal approach. We can work collaboratively with those who are being regulated, and often they will cooperate. Everything from quarantine and isolation to an organization will often work together if we try that first. Sometimes it doesn't work. We have administrative, civil, criminal, and judicial. And again, Mike nicely hit these, so I'm going to let you read most of these on your own. About inspections where we go in and we dig down, we measure to make sure people are meeting those requirements. And if they don't, then we have things like court orders. This is an injunction or order by court to say you have to stop doing something or you must do something. And so that's the key part as well. We have the civil sanctions and the criminal sanctions, which again, Mike spoke about so well. And again, these are designed to try to ensure that people are following. And I would note that all of these health law tools aren't just used usually one. Sometimes we use only one, but generally we use all of them together. And I've given you some examples of how they all might work together. So, gosh, time flies when you're having fun. Again, we noted the importance of relationships. The governor and the legislature, the Department of Public Health, of course, has a liaison relationship with local boards of health. All of you work with healthcare providers and facilities in your communities. You have district, county, and city board supervisors, as we mentioned, city councils. In some cases, that may actually be that your local public hospital has the board of supervisors as their board of trustees. And you also will be working with them as a local board of health. So it can be quite interwoven. And then we have, again, the local board of health. So those relationships are important, and you don't want to wait to work on developing those relationships until there is an emergency. You really want to work together and know who to call and when you can. So I encourage you to do that. I put a little bit of information about contracts. Mike had mentioned that, you know, we have intergovernmental agreements between counties, it could be between the city and a county, and it could be within regions, or it could even be within states. So 2080 is the general agreement that we use between counties or municipalities or other groups within the state. And then 28B is when we're doing something interstate with other states or municipalities. MOUs are memos of understanding. Those are where we really, it's a little less formal than a contract, but we're really getting on paper what it is the parties intend to agree to. And then MCOs, managed care organizations, we don't really have time to get into this in any detail, but often with the Affordable Care Act, we now have a host of different things that we're really good at in public health, like critical needs assessment, or that a managed care organization has decided that part of what they're going to require a payer or provider to do is that they have to meet certain public health standards or criteria. And so they're going to be working with you. So you're going to have contracts related to that as well. One of the key things, if you remember nothing else, put a star on this PowerPoint, is recognizing the issues and knowing when to consult somebody like Mike or your county attorney, because we're not going to answer all of it today. So number one, be prepared. Know where to go and who to go to. Allow them to educate you. Obviously, if contracts or memos of understanding are involved, you're going to want to engage them. If there's any sort of even potential liability, you're going to want to involve them. If you, for example, have a nuisance and the person is not voluntarily abating it and you're getting resistance, or they're not letting you onto the property for search and seizure, then you're going to engage your county attorney or someone else. When you get a court action or are applying for one, you're going to use them. Anything that interferes with individual liberty, bodily integrity, when we start talking quarantine, isolation, et cetera, inspections or seizures, when you want to verify that the law permits a planned action, and frankly, I would say just when you don't know and you get this little flag in your head that says, man, maybe this is legal, go talk to somebody and get legal counsel. When you're not sure about the scope of the agency's power, when you have questions about the process you should follow, in Iowa we have 17A, the Administrative Procedures Act, same as we have with the open records and open meetings. And then when we want advice on unique legal provisions or whether or not we should release certain information, because we have requirements to provide surveillance and be open, and then we also have privacy requirements for those we provide services to that also connects with HIPAA. So when you don't know, ask. I'm going to, because I want to make sure we have time for our local partners, to allow you to kind of read some of these other slides, and of course you can get in touch with me, but there's a host of specific topics that relate, including public health nuisances. If you haven't I would encourage you to go to your county and look at the complaint form and the process that is followed when there is a potential public health nuisance. And at this point, one of the key things we are hearing a lot about in local public health is animals. So I'm going to turn it over to Brian to provide information about some of the issues that they have encountered in local public health that would be a good illustration for you.
And Brian, I'm here to move your slides forward when you're ready.
Great. Can you hear me okay?
Yes, we can.
Outstanding. Well, first I'll say a little bit about myself. My name is Brian Honoff. I'm the Director of Public Health for Sarasota County Department of Public Health. I've been in this role as the director since this past April, but I've worked in environmental health for about the last 25 years. I want to give a few shout outs. Mike and Denise, I think that was a fantastic overview, and Steve does a great job recounting some of the issues that he's had in his county. I also want to say thanks to the Iowa Department of Public Health for promoting this, and to the participants who are listening in on this. I think this is an outstanding series, and I'm happy to contribute. So if you want to move on to the next slide. I'll preface this by saying this is normally about an hour presentation, one that I've made several times around the state and during conferences. So I've tried to condense this. So I'll move through these slides relatively quickly in recognition that people can review my slides and certainly reach out to me at the contact information here. But I'm talking specifically about dangerous dogs and ordinances related to it. Taking action in your community. I've received a lot of dialogues and questions from people around the state and even outside the state about this particular topic. And so I'll initiate it by telling a bit of a story. So next slide. Anytime I present this, I always start with this because this is actually a picture of a little girl who's bitten by a dog in our county. Happened pre-2013. She was 5 when it was happened, and she was, Gage was the name of the dog, bit her. Clearly in the face with significant lacerations that needed to be addressed. It happened on a Saturday, and so the next slide just shows some of the repair work that had to be done on this little girl. I had a copy of this picture hanging up in my office, kind of as motivation to be able to continue to deal with dangerous dogs as they happen to come forward. So next slide. The very next day, this same dog bit another child. She was 11 years old, also bit her in the head and required stitches in her forehead and puncture wounds in her skull. The dog didn't have any vaccinations for rabies. The owner refused to euthanize the dog under the code of Iowa, Chapter 351, which I'll hit on more in a minute. And so unfortunately, trying to deal with the dog and ultimately euthanize that dog, we were not successful. So it was kind of our motivating situation to address coming up with a different ordinance that would give us a little more authority than Chapter 351. As Mike alluded to earlier, county boards of health can be more strict in ordinance generally than the state rules. And in this particular case, we did proceed with writing our own rules. Next slide. I won't read through this, but I do point this out to all attendees to review Chapter 351 of the Code of Iowa. It does hit on a lot of obligations that draw in local law enforcement and local boards of health. Specifically, it relates to quarantine and confinement of animals that may not be current on rabies. Next slide. So when I talk to others around the state, I point out that there's really no need to reinvent the wheel per se. There's a lot of ordinances that are out there, and these are just some of them that I spent time over the course of several months reviewing. And again, some of these ordinances go into a lot of broad issues related to exotic animals, breed-specific rules that prohibit certain dogs, farm animals. Some deal with animal droppings, fecal animal fecal waste that might be left in parks or whatnot. After doing the review, we kind of learned what we did want and what we did not want. I also want to point out that dogbitelaw.com is an outstanding resource that we found to help us as we developed our own local ordinance. Next slide. So from our research, basically, we determined really breed didn't matter. A lot of communities, and there's several around the state who have adopted breed-specific bans. But as you can see from my first couple of slides, that little girl was bitten. Those two little girls were bitten by a lab, and there's more bites that occur with Labradors than any other breed. So we knew that we didn't also want an animal control ordinance. I honestly just didn't have the staff for it. We also didn't want to deal with the dog or animal feces, and we didn't want to deal with barking or loud dogs. So, and neglect issues do become a discussion point sometimes. We just, again, didn't have the capacity to be able to do that. Most importantly, we were really focused on the public health protections, and wanted an aggressive policy for dealing with dangerous dogs. Next slide. So this is kind of the procedural process that we've gone through. And I will say, Sarasota County, our Board of Health has approved more than a half a dozen local ordinances, all of which are available on our website. And the process really is quite awesome when you really dive into it. It's not only awesome, but it's also relatively simplistic once you learn how that process works. So for us, we developed an ordinance using the guides, as I mentioned. We do receive legal review of any of the rules that we put together by actually a private law firm rather than our county attorney's office, namely because our county attorney's office just doesn't have the capacity to deal with some of the civil issues and the ordinance rules that we need assistance with. So in our particular story, we submitted this ordinance to our Board of Health in about May of 2013, and it passed our board with a 5-0 favor. In this case, we utilized the parents of the little girls who were bitten to really help push the issue, and really there was no issue in passing those rules. We then presented that ordinance to our Board of Supervisors in June of 2013, and our process generally is we like to do an introduction with our Board of Supervisors after Board of Health have approved rules, and just talk them through the rules, the ordinance that we've drafted, and then allow for them to ask any questions without taking action. Then we ask them to put that on their next available meeting for public input and for adoption, and then they go through the general rules for that adoption process. In this particular case, we had no public comments against the passage, and the parents of the little girls also attended the Board of Supervisors meeting. There was full support, and it was then implemented in 2013. In this case, the Board of Supervisors did choose to waive the second and third readings, namely because there was no public backlash, there was no public outcry with it. So next slide, please. Just some quick statistics that you can read through, but we do track how many reports we received. You know, I did reference something that Mike said earlier about, you know, if cities have rules in play, then we don't necessarily want to step on toes, and we can't. The city of Mason City, also the city of Clear Lake, has their own animal control rules. So in most cases, we generally don't get involved unless there's a means by which we can support those municipalities with our particular rules as kind of reinforcement. Next slide, please. So these are just some statistics that I like to periodically use when the time is right. And you can see how many dog bites there are across the country. The average cost per claim in 2018 rose 6%. So the average dog bite will cost dog owners and insurance companies greater than $40,000. Next slide. Just some additional national statistics. Poor postal workers who have to deliver mail, you know, 5,800 postal workers are bitten each year. And it's pretty astonishing when you look at these statistics. You can really find a lot more information about some of these statistics on dog bite law. And I would encourage you to check them out if you have an interest. Next slide. Again, just some more information. 87 cities and counties have dangerous dog breed ordinances. Those numbers might be slightly different. Some municipalities in our county have actually stepped back from having pit bull bans and focusing more on dogs in general. I certainly do not recommend breed-specific rules. It really does box communities in and dealing with dangerous dogs as a whole. Next slide, please. So I just wanted to run through some things, how dog bites actually work in our county. So it works really well in the sense that we work very closely with local law enforcement, our local vets, and even our humane societies. Calls generally taken by dispatch from either the dog owner, which doesn't usually happen, a victim or a bystander, or the victim presents to the emergency room, and the emergency room staff will give us a call, or they'll call local law enforcement. Next slide. Generally what happens is local law enforcement will conduct the initial investigation, collect case information, and it may mean that they have to respond to the ER where the incident or the victim is receiving care. Sometimes it happens late evening hours, and law enforcement's much more on staff, more than local public health staff are, nights and weekends. So local law enforcement has coverage during these hours. And generally what our team does is they'll send us notification of a bite report. And I'll show you what that report looks like in the next slide, please. So what happens is local law enforcement out in the field 24 hours a day will use this Google Doc form, and they'll send us this information, which as soon as they hit submit, then that relays to our department, which shows up in about a dozen people's inboxes. So the first person to see that Monday morning generally will initiate a follow-up. Follow-up with the local law enforcement, sometimes dispatch, and then start reaching out to the contacts that have been presented from law enforcement. Next slide, please. So that's just what the report looks like in our email account when we receive it. And again, it gives us some of the general information so that we can follow up the next day. Next slide. The cool thing about this is public health role in this. We receive notification from law enforcement. Sorry, LE is law enforcement through email, fax, or phone call. We then will review that information, often follow up with law enforcement if we need. During the follow-up, then public health will follow up with all parties involved. We then draft the documentation related to the dangerous dog rules, and we then fire off the letter of notice to the dog owner, basically placing either the designation, the appropriate designation, which is either potentially dangerous dog or a dangerous dog designation. Again, as mentioned earlier, we do have an appeal process that's stated in there, and then generally a closing statement, but we always have to reference that appeal process, which is indicated in our county ordinance. Next slide, please. We then also follow up making sure that dogs are current on rabies, which is specified as a primary Board of Health role in Chapter 351 of the Code of Iowa. Generally, we will have expectations to insert microchips by a licensed veterinarian. We can then enforce a whole host of different requirements, which can include installing a fenced kennel with cement floor and a shade and that sort of thing. We can require obedience training for the dog and the owner. We can require muzzling, notification to utilities, notification to the bite victims, and then certainly ongoing oversight and monitoring for compliance. Next slide, please. It really hits on the important point between working with local public health and local law enforcement for a really complete oversight for these types of cases. We really, once the local law enforcement does their initial investigation, then we do all the heavy lifting for them, and they're certainly happy to give up some of the paperwork responsibilities and then the follow through. It also the two agencies provide quite a bit of credibility if and when a case goes to appeal. For us in our department, the appeal process goes from the administrative authority to the local health director, which is me, and then ultimately they can appeal that to the Board of Health. The Board of Health ultimately has the final say in this. Of course, there's always that process where they could take us to court. All the while, an animal that's been quarantined will remain in quarantine at the cost of the dog owner until the full process is complete. So next slide, please. Just hits on some of the ordinance specifics, which in the sake of time, we'll just move beyond, because again, people can check out our ordinance on our website at cghealth.com. Some issues we see going forward, just dogs and their owners tend to move from town to town, so they also move from jurisdiction to jurisdiction. And trying to keep track of those dogs can be rather difficult. Some people have multiple residences in Iowa, and this particular case, if a dog bites in one jurisdiction, the neighboring cities and counties generally are going to be unaware of that dog. We did have a case recently where a dog, his name was Henry, was summered here in our particular county and then actually went back to another county, and we generally relayed that information between our two communities. So next slide just focuses on some long-term goals that we think could be enhanced throughout the state. And one of those is to promote statewide updates to Chapter 351. It doesn't appear to be on the legislative agenda this year, but we keep that out in front of us. And so with that, I present to you some of our contact information, and I'm very open to any questions or certainly emails after tonight's presentation.
So we had a few other slides, but in essence of time, we're going to kind of scooch through those. We've talked a little bit about disease control in the sense of outbreak types of things, or in the sense of like rabies and some of those other types of things. I'm going to give you an example of exclusion orders that may be given by the Board of Health, or actually the agency goes through that procedure or practice, and they're actually a state authority. There is some information on isolating quarantine in here. There's also a presentation on the Leadership Academy website that you can go through and look and learn more about isolation and quarantine if you'd like. But what I'm going to talk you through, like I said, it was a great example that Brian just shared with us about local ordinance development, enforcement, and monitoring. The next example that I'm going to kind of walk you through is actually state authority that's administered at the local level. So that example is actually exclusion orders to protect the public's health. The Iowa Department of Public Health has the authority to write orders to exclude individuals from work or daycare if the department feels there is a potential threat to the health of the community. To help illustrate this process, we spoke with Siouxland District Health Department, so we kind of knew if we had three local people kind of talking, and both Mike and Denise, that it might be tight. We're already tight for time. So we just kind of interviewed them to learn more about their processes. So here's what we found out overall when it comes to exclusion orders. The Iowa Department of Public Health guides local health departments in the exclusion process, but that is done through both IDPH and then working with local public health agencies to go through that process and do kind of the boots on the ground work. So each health department with that boots on the ground work can develop or design their own procedures. And Siouxland District Health Department shared their procedures with us. So their procedure is as follows. First, they receive a notification of an infectious disease in the county, and they follow up on that report. They then determine whether the person is a food service worker, a daycare worker, a healthcare worker providing direct patient care, or a daycare attendee. They then notify Iowa Department of Public Health of the need to exclude this person from work or daycare, and the Iowa Department of Public Health writes the orders and sends it back to Siouxland District Health Department. They then issue the order to the person either electronically, and if they do it electronically, they actually ask for confirmation of receipt of that information, or it's done in person. They explain the orders to the case as well as the process for getting the orders lifted, because again, they're not allowed to go back to work. They can do other activities as long as it's not something that's going to threaten the public's health. So if that person is headed to a potluck, and it's a healthcare or it's a food service worker, not a great idea if they're the one providing anything at a potluck. Usually that involves obtaining, so the process of lifting that order involves obtaining negative stool samples. So that individual then is also responsible for collecting the stool samples and getting those to the department. So then Siouxland District Health Department offers to facilitate the necessary testing and provide cases with any specimen collection kits that they might need. When the required test results have been obtained, Siouxland District Health Department notifies the Iowa Department of Public Health. IDPH then writes a release and sends it back to Siouxland District Health Department, and they then get that release in writing to the case, and at that point, the health department's involvement is over. They also shared that they have some interaction with the case's employer or the daycare provider. So this order issuing system gives cases something official to give to their daycare or their employer, but really the health department's involvement it kind of stops with the case because of the orders available. So they don't interact much with employers or the daycare providers themselves. If they are asked to interact with them, they can actually, the health departments are allowed to tell them the name of the person that's excluded, but cannot tell the actual diagnosis of that individual. That's up to the case if they want to let their provider know. So that's just another example of how we've got something in statute that the Iowa Department of Public Health actually writes the order, but then the local health department is asked to follow through the procedure and do the monitoring piece, maybe even some of the enforcement pieces. And again, that's all voluntary. So if that's not happening, there's other things that they can do to do more of a mandatory exclusion, or that then transfers into isolation and quarantine. And like I said, that PowerPoint presentation is available on our website. We also were able to get an example order for a food service worker who was excluded from work last year that Siouxland District Health Department had. That can be found on the Leadership Academy website. All of the information is redacted, so you don't have to worry about any privacy issues as you look at that. But if you're interested, if you haven't had an exclusion order as a part of your agency's work or your Board of Health work, you can access that on the website itself. So our next webinar is going to be on health equity. And so we'll talk through a variety of information about looking at health equity. So kind of thinking about public health isn't a one-size-fits-all type of approach. And we've got some great speakers who are lined up for our next webinar to do that.
Okay, thank you to all of our speakers today. If you have any questions, we will answer those now. We have about 6 minutes left. So if you have questions, you can send them through the Q&A function, or you can send them by chat. We do have one question here. It says, if counties share a position, such as zoning and environmental health, and the employee's time is split 50-50 between each department, how do you recommend the Board of Health and Board of Supervisors handle that type of shared employment situation? For example, would you recommend that there be an MOU or a 28D?
This is Mike Bennett. First of all, I'm going to say this thing I always say in every question of this nature. You really should talk to your county attorney because they are your legal advisor. And so there may be facts or circumstances that are important that when you ask a general question like that may not be obvious to somebody who's not your legal advisor. So I would suggest you talk to your county attorney on that. But I would also say that 28E is an agreement between different governmental agencies. The way it's defined in that particular chapter, that term indicates that these public agencies are political subdivisions of the state or other governmental units like the federal government. That suggests to me that really, and I have not personally seen a 2080 agreement in the past that was between different parts of the same county government. I think most of the time you see those people entering into those when they're dealing with another governmental entity like a city and a county, or more than one county, or the state and and counties or cities. But by all means, if you have a question on that, please talk to your county attorney so they can look at all the facts that apply in that situation and give you advice that is informed with all of those factors.
Thank you, Mike. Do we have any other questions?
I just would note for you that, again, if you can start thinking of the law as a tool for you to try to improve population and individual health and become familiar with these resources that we provided, it really will help you in the mission-driven decision-making that you're making within your organization. So thank you for your time today.
All right, thank you to everyone. That will conclude today's webinar. We will be sending a recording of this webinar out to you all in the next few days, and it will go on the Public Health Leadership Academy website soon after that.